Thank you, Presiding Officer. I welcome this debate and congratulate my colleague Claire Haughey on securing it. I led this debate previously in the last session in 2020, and I'm pleased to continue my support for World AIDS Day and the opportunity it presents to raise awareness of HIV and AIDS. I also thank Terence Higgins Trust, Waverley Care and HIV Scotland for their briefings and for the invaluable work that they do to support those living with HIV. I want to start by emphasising that thanks to scientific developments, a person living with HIV in Scotland today is, if they're on the right treatment, they can live a long and happy and healthy life, and they cannot pass the virus on to others. We've heard colleagues mention that already. Once a person has received a diagnosis, receives appropriate treatment and becomes undetectable in their viral load of the HIV virus, they cannot pass on the virus through sexual transmission. Waverley Care, along with NHS boards across Scotland, including in Dumfries and Galloway, continue important work to promote the need for people to know their HIV status. They are also promoting the undetectable equals untransmittable, U equals U message. Presiding Officer, when preparing for this debate, I reflected on my time at Cedars-Sinai Medical Centre in the heart of West Hollywood in Los Angeles, when I worked there as an operating room nurse in the early 90s. This was when combination antiretroviral drugs were just starting to be used, and the stigma associated with HIV and AIDS was absolutely rife back then, including from professional colleagues. And I'm glad we've moved on and that Scotland is leading the way in HIV, AIDS and stigma reduction. And just to note the work of LGBT Youth Scotland in their recent Life in Rural report, it demonstrated that HIV and AIDS stigma is more prevalent in rural areas, so we must pay attention to that and ensure that rural Scotland is targeted to achieve stigma reduction also. When I led this debate in 2019, I spoke about the progress which was being made in Scotland to meet the United Nations 90-90-90 targets. They stated that by 2020, 90% of people living with HIV would be diagnosed, 90% of those diagnosed would be receiving treatment, and 90% would have an undetectable viral load. And despite the measures caused by COVID-19 pandemic, Scotland has met these targets. 92% are now diagnosed, 98% are receiving treatment, and 94% have an undetectable viral load. So that is good news. I do pay tribute to NHS Scotland staff, such as NHS Dumfries and Galloway Sexual Health and Bloodborne Virus Nurse Consultant, Mary Murray, for the trailblazing work that they do to support those living with HIV and AIDS. Mary, in particular, has broken down many of the barriers for people coming forward for screening and treatment, and she has been fundamental in helping to reduce HIV and AIDS stigma, particularly among colleagues in Dumfries and Galloway. Presiding Officer, we've heard already from colleagues that today in Scotland HIV is considered a manageable long-term health condition with treatments like PrEP and PEP, which allow people to live long, healthy lives. I caught up with the Terence Higgins Trust at our conference in September and was pleased to hear about their new joint campaign with the Scottish Government, Stigma is More Harmful Than HIV. This landmark campaign, the first on TV for 36 years, takes the topic of HIV to the Scottish public and provides an insight into stigma people living with HIV in Scotland face today. It also provides important messages on HIV transmission, treatment and care. So I'd encourage members right across Chamber to engage with the campaign, share it on your social media and promote the importance of people knowing their HIV status through testing. Testing has a central role to play in reducing the number of new infections, and it's as simple as a wee finger prick blood sample. So, Presiding Officer, my ask of the Scottish Government is not to take the foot off the pedal and to continue public awareness campaigns of the importance of sexual health tests, including for HIV and AIDS, and to continue to show that HIV and AIDS stigma has no place in Scotland. Thank you.